Welcome to the first edition of On the Couch with NMC, a show where we want to have candid conversations about lifestyle and social issues that are affecting us. My name is Jeanine Teega. I'm the lifestyle coordinator for NMC. And on today's panel, we are joined by Dr. Wanja, who is a doctor in academics. And we also have Dr. Mansfled, who is a general practitioner. On my left, we have Dr. Bruwer, who is a pulmonologist. And then on my far right, left, we have Michelle, who is a clinical psychologist. We want to understand the vaccine. You know, today we understand the vaccine, tomorrow we don't understand the vaccine. And information right now is so key and valid. You know, we need the right type of information. And then, of course, we have the mental aspect. If anything, COVID-19 has taught us that we need to preserve and protect our mental clarity. And then finally, I believe that for us to find out really the effects that COVID-19 has on people is to hear it based from people that have experienced it firsthand. So we also have people that are COVID-19 survivors. And yeah, let's dive into it and just have a discussion about COVID-19. Well, my first question would go out to Dr. Mansfled. How are you this afternoon, doctor?
Alive.
Doctor, I just wanted to know, we have this perception outside that once you have underlying issues, and most of the underlying issues, I believe, are the gateway illnesses that we know, such as diabetes, hypertension, cholesterol, obesity. And people have that perception that once you have those underlying issues, it makes you more perceptive to the COVID-19 virus. And I think the message out there is also, people with underlying issues, vulnerable people. And I think, if anything, the third wave has taught us that underlying issues does not really matter that much. Or what's your take on it?
Look, what I've seen in the rooms and, personally experienced between myself, family and friends, you're more vulnerable if you are, like you said, hypertensive, have diabetes, have all these. But unfortunately, this little khocha doesn't distinguish between who and what. I think that everyone is vulnerable. I think the way we act, the way we behave in public has a greater responsibility how sick we get or not. I think how much viral load we get in is also a big, predictor on how sick you can or can't get. If you're the one that runs around in the gym and doesn't wear a mask and goes to like in England now, to the nightclubs and all that, I think your chances are better being hit harder by the corona organism than if you've been just pure and simple, staying in your small social bubble, making sure your comorbidities and everything is as much under control as possible. It's highly unpredictable. If I just take personally in the family, 3 of us had it and 3 of us had it different variations. From quite light to quite severe, no predictor. No, my son is a diabetic, and I never even thought he had COVID with his light symptoms. No, it was just, why isn't your sugar controlled? Yeah. And once we knew whoever had, it was different. But I've seen in the rooms also, the patients who I'm worried the most about, little happened. Days where I said they should slide through, they're not. It's unpredictable. First time in medicine where we have something, it doesn't follow a predictive course. I know, like in medicine with anesthesia, we know this is your body weight, this is how much we give you, this is how deep you'll sleep and how long you'll sleep. We haven't got it here. Some people are sick and back and healthy in 2 weeks. Some people have it for, I'm going now on my 7th week. And I'm still not 100%, my fitness level I had beforehand. Yeah. So I think best way is social bubble, sanitize, mask, stay away. If you have the comorbidities, just be more predictable, more careful.
Dr. Bruwer, I'm going to give you this question. Dr. Mansfled mentioned something that 3 of them had the COVID virus inside the house, but they had different types of symptoms. And once again, you know, word on the street, we feel, or we have this perception once again that people with that show symptoms are more contagious as opposed to people that are asymptomatic. And believe it or not, we actually do find people that are asymptomatic that feel that they are not contagious, so they probably become very reckless and they still expose themselves to other people. Can you be asymptomatic and still contagious?
Yeah, I think that's one of the big problems with coronavirus is that you have this large percentage of people that get infected and are asymptomatic. That's why it spreads so effectively, because it's specifically those people, they feel they don't have to isolate, they don't even know they're sick in some cases, and then they go to gatherings and meetings, work, whatever situation, and then they spread the disease. If you look at the previous coronaviruses, the SARS virus, SARS-CoV-1 and the MERS virus, in those cases, they did not have that asymptomatic carriers, if you want to call it that, and they so most people got disease, got sick, and it actually limited the spread of those 2 variants of coronavirus. Whereas in this case, because of the asymptomatic carriers, we do definitely see more spread, and that's why we're sitting with this worldwide pandemic.
Wow, that is difficult. Is there something that we can do when you're asymptomatic just to maybe find out? Because is it ever going to end? Because now here I am, I'm asymptomatic and I'm just walking around. It's not necessarily to say that I'm negligent, you know. What?
So the thing is, what we have to still do the basics which we did at the start. I mean, still wear our mask, even though we still should social distance. We should avoid large crowds, specifically because of that reason, that we don't know that you're actually a carrier. And then we'll talk about it later, but also vaccinate, because vaccination will help us in that regard as well.
Yeah, for sure. No, we're jumping right into the vaccination right now. We have the 2 vaccinations. It's the Xenofarm and the AstraZeneca that is available right now in Namibia. And I just want us firstly to talk about its efficiency rate at the current moment, just because of the mutation of the virus as well. We have a little bit of doubts. You know, do you take it now? Are you still fine? Has the efficiency rate dropped? And, you know, just that fear. I think people have that fear when it comes to the vaccine.
So I think when you look at vaccines in general, one has to firstly understand that when we talk about efficacy, then it really depends on what we're looking at. Are we looking at it as preventing disease, or are we looking at it as preventing severe disease and hospitalizations? Okay. So if you look at preventing disease, both of the vaccines that we have, the Sinopharm and the AstraZeneca, sits at sort of around high 70s, low 80%, looking at which different study you look at. But that is only in preventing disease. If you look at preventing hospitalizations and preventing severe disease, so ICU admissions, then they're way more effective. Then they sit in the high 90s, 99% in some cases. So, again, we have to look at what our aim is. For instance, if you look at the yearly influenza vaccine that we take, there the efficacy in preventing disease is around sometimes even as low as 44%, and going up to the low 50s in a good year. So our aim with the vaccines is not to necessarily prevent disease. It's one of the, call it side effects. It prevents disease in some cases, but we want to prevent hospitalizations and ICU admissions and death.
Yeah.
And in that case, both of these vaccines are quite effective.
They are. But they do have a side effect as well to some patients.
Yeah, all medication have side effects, and yes, there are some very rare side effects, and then there's more frequent common side effects. Most commonly, you have some muscle pain or pains at the site of the injection, maybe a bit of fever, maybe a bit of aches and pains.
Yeah.
That's common side effects. The severe side effects are fortunately extremely rare, and they really don't happen that often. I mean, we know about the social media and mainstream media reporting on blood clots, for instance, forming in certain cases. But fortunately, those things are extremely rare and shouldn't be of major concern to us.
I think one more question for you. So we currently have a shortage when it comes to the vaccines. Say, for instance, I got my first jab for Sinopharm or AstraZeneca, and I need to get the second jab, and there isn't that vaccine available. Can you mix these two vaccines if I got Sinopharm and there's on AstraZeneca? Can you mix it?
So currently the recommendation is not to mix them. You can use different types of vaccines, but the recommendation is still to finish the one. So for instance, you had Sinopharm, you had one dose, get the second dose, and then for whatever reason, currently in Namibia, the government doesn't recommend it, but if you look at international data, there are some sort of studies coming out that may be adding a different class of vaccine might be beneficial. So I think that can be done, but still the recommendation is first finish the one that you started with.
Yeah, and if you do not get your second jab within that 2 to 3 weeks that you're supposed to get it, does the efficiency of that vaccination then drop?
Fortunately, we don't know the exact answers, but what we do know is, for instance, with the AstraZeneca, if you look at when they started with the development of AstraZeneca, they looked at giving the second dose after a month, and then they pushed it out 6 weeks, if I remember correctly, and at the moment it's up to 3 months. And the reason why they did it is they found that waiting longer between the two doses actually increases the efficacy.
Yeah.
So it makes it more effective. So in delaying that, we probably won't have more sort of, or less effective vaccine. Why we don't want to infinitely delay it is we want to get the population vaccinated. So obviously that time, because the vaccine is only really effective 2 weeks after your second dose in this case. So by delaying it, we increase the risk that the patients actually get infected or exposed to the coronavirus. So we don't want to delay too long. But,
we're going to move on to you, Michelle. And I do know that right now, the thing that is the emotion that is probably clouding the whole of Namibia, because we are going through a great loss, not just loss of incomes and loss of jobs, but also loss of lives, And it seems to me that COVID-19 is very it's linked to fear. Has the narrative when it comes to fear changed completely? Because for me, fear equals to death. And when you have this virus, COVID-19, or when we even just speaking about COVID-19, you can see that people are really afraid of it. Our whole attitude towards it has really changed, and we are so afraid to it. Do you think there is a way that we can still disconnect it and just have normal fear, or how can we deal with this fear currently right now?
If you look at fear, and we all have a fear, I'm sure, and you look at what is the underlying pattern in fear. Most of us fear because we fear the unknown. So whatever you fear, if you look into your fear, you're going to see, I fear this thing because I don't actually know enough about it. I don't know what it can do to me. Can it kill me? Can it harm me? So when you want to look at fear and you want to look at what you're fearing and you fear the unknown in it, you have to educate yourself. There's that saying, face your fear. And I know it's just a saying out there, but I think what that saying is actually talking about is educate yourself. Prepare yourself for if you were to face that fear. And when we look at fear and what is the reaction to fear, the kind of universal reaction to fear is to run away, to avoid, to get away from that thing you fear, which I think is something what we were seeing in the beginning with COVID. People were avoiding COVID, people were trying to say that it's not real, it's not there, because that fear was in them. So if you're fearing COVID, educate yourself. Ask the right questions, but also to the right people. Make sure you are educating yourself, but that education is factual, because that will minimize the fear. It won't take it away completely, but it will minimize it.
I definitely agree with you on that one. Dr. Wanja, I know that you are a COVID survivor, and I just wanted you to share your experience while having the virus. Our target audience is the normal people, me and you, and I do believe that people should hear firsthand, how this experience was. And I do know that you were very vocal about what you went through and how it has changed you. So just your experience while you were having it and how has it changed you?
Thank you, Jenny. I think for me, it was something you didn't expect to get. I think I'd done everything I needed to do. I was fully vaccinated. Last year, when COVID came about, May, I took care of somebody who had COVID, one-on-one. I have underlying effects and I was not infected. But so for me, getting infected now was out of the question. And I can't even tell you where it happened because I think I did my best. Even my students in class, anybody who came to my classes, they were very uncomfortable because you didn't remove your mask for as long as you were in my class. We had breaks, but you didn't. I was very careful. But once you get it now, it's and for me it took a while. Because I think I was in denial for about 3 days or so. I couldn't even eat. I couldn't get out of bed until my son realized this was getting out of hand. And what happens is that because you're still in a bit of denial. In fact, what happened is I went to hospital at Lady Pohamba. I'd just been to Lady Pohamba for surgery, and barely 2 weeks I was back there now with COVID, and I was going for my appointment to check on my surgery. And I couldn't get out of the car. I couldn't get out of the house. My son almost literally got me there. At the hospital, they had to get a wheelchair to get me into the clinic. When the doctor saw that, and he decided something else is wrong here. And of course, they took me to the casualty. And I think what happens is that just like that, you're scared. And by that time, I was out of breath. I was really out of breath. I couldn't speak any word without panting. I think I even went into some sort of subconsciousness, because the next time I remember, I was on a bed or some sort, and it was many hours later with all those other gadgets that they put on you. And that's something I've never gone through, because I've never been that sick. I take myself to hospital to do things. This time around, you're literally being taken there. And your experience is nasty. But as doctor said, because he was my doctor, one of the things he said is, and which I still remember, is it was one of the most important things that had happened is that I had been vaccinated. And with my underlying other conditions, including diabetes and maybe many others. If I had not, to be honest, the condition I went in there, I'm not sure I would have gotten out. So as one of the things I do now, very important, is to tell whoever can get vaccinated, because you don't know where you'll get this thing. You don't even know. I tell people, before I used to tell people, it's about if, now it's about when. So do your part and leave the rest to go. If it's getting to doctors, it's getting to people who you don't think can get it. Anybody can.
I know, Dr. Mansfled, you also recently had COVID. I just want to know that, I do know that once you've had COVID, after COVID, you pick up quite a few long-term conditions.
Look, there is some long-term conditions. Not everyone has. Some people different. The one that's most frustrating to me is I get quickly out of breath. I can't exercise. It's difficult because now I have to limit my food intake, which is not always so easy. I found the most frustrating was when I had the COVID was I had an irrational anxiety, and it was actually the COVID bug. I see it in my own patients also, and I wasn't afraid of dying. Okay, I was, but the anxiety you more have is. A good mate of mine, he was fighting with the whole family while he had COVID. Me, you just looked at me skew and you're crying. No, you're emotional, you're anything. That can stay also for long, and people won't admit to that. The long-term effects of it is underestimated. I see at some companies, they say you have to be back within 2 weeks. 10 days from the test, you must be at work. You maybe get the 1 day off to go to wherever they give you out the certificate saying you're not contagious anymore. I think we must look at the patient. You look at them holistically, the whole patient. If he's a manual laborer and he's short of breath, he's no good trying to do any work. If you're sitting in an office and you can't concentrate or whatever, send them rather home. So I think that the post-COVID, and it's also difficult to distinguish between who wants to be sick and who is sick. Some people say, but my boss got 3 weeks off work, I also want 3 weeks off, I want to rest. So it's difficult. We as doctors are actually scared to see the patients in our rooms because we don't want, I'll see the post-COVID patient, but the COVID self-patient who's still in the contagious period, you have to sit in the car outside. I'll come there, examine you. Because I'll get Mrs. X coming in for blood pressure tablets, who's 74, who's healthy. I don't want her to get the bug. So now you say again, who do you let to come? Who don't you come? How do you treat on the telephone? So I think that whole thing is, it's not as easy as someone who had pneumonia and you know how they'll respond afterwards. And I think the long-term effects, the more I try and read up, the more the picture actually becomes wishy-washy. This one has it long, but didn't have COVID severely. This one was in the ICU for 3 weeks, and within 2 weeks could go to the gym again and feel strong. Why this one and not that one? This one got vaccinated and still got sick. These got vaccinated and hardly had anything. I think we're learning. If we speak to the medical profession again in 3 or 4 years' time, I think we'll understand this khocha. We'll have a much better understanding. We know which drugs to use, how to use. The psychologists love these forms, disability and anxiety scales. We'll have one for medicine, for COVID. You come in, the doctor says, pulls out, tick, 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 tick. Okay, you still got long COVID, you haven't got back to work or not. And that is what we haven't got at the moment. Everyone, I looked now in Windhoek, especially when I had the COVID. I don't know how many GPs we are because we're a lot. I think the consensus, most of us use roughly the same medicine. But if you take 20 doctors and you put 20 scripts next to each other, I think you won't find 2 scripts that are the same. Everyone uses different regimens. This one will use ACC 3 tablets 3 times a day. This one says, you only need 1 a day. Now you're not coughing, you can leave it. And I think this just shows you how this is the same as the long-term effect.
Dr. Bruwer, when it comes to COVID, and I'm sure a lot of people out there, we're still having that question. Why is this virus so aggressive on our lungs? Why is that the target organ?
So, coronavirus, firstly, the site of entry is our respiratory tract. So mostly eyes, mouth, throat. And from there, spread to the lungs are quite easy. But one has to understand coronavirus is actually also a vascular disease. And all our blood circulation goes through the lungs. That's just how our physiology works. But it also affects other organs. I mean, it affects the heart. Erich was talking about long COVID and chronic fatigue. We know the heart plays a big role as a target for the coronavirus. Other organs as well, kidneys, liver, brain. We spoke about this, the forgetfulness and the sort of lack of concentration. So all the organs are affected. We just see the severity of the disease more in the lungs, because if it does affect the lungs, the first thing is oxygen dependence, and then from there the sort of the snowball effect is for the rest of the organs. So it can affect any organ, but primarily the lungs.
For our pregnant mothers out there, I want to know how safe is the vaccine right now for them to use it, to take it, and also for their babies, their unborn children. How does it affect them?
Okay, so most of the studies, usually when we have new medication, it goes through trials, and the trials initially they don't include pregnant women. So initially we weren't sure, but fortunately, in a way, during doing these trials, I found that not many, but a few of the patients ended up getting pregnant, or falling pregnant, and through that and through real world experience now that we have, we've seen that it's actually effective in pregnant women, and it's actually quite safe. It's got a very low risk of any complications. I still think the recommendation is that you do, if you are pregnant and you want to get vaccinated, just speak to your gynecologist, that they advise you. I think the government recommendation is that that you can get vaccinated in the second trimester without actually having a referral letter. But I would still recommend that you at least have that discussion with your obstetrician before getting the vaccine. But it seems to be safe.
Do you have any home techniques that people can use probably for breathing challenges and stuff?
So the interesting thing, and I think there's also a lot about it in social media, we know that when you lie on your stomach, when you're prone, the distribution of air into the lungs are good, or the better to the good parts of your lungs. So our lungs, our sort of bases at the back, if you want to call it that, is the areas of the lung that is most effective in gas transfer. So if you sleep on your stomach, you take the weight of your heart, for instance, off that part of your lung. So we often, even in hospital or at home, recommend that people sleep on their stomachs if they can. I know it's not the easiest position to necessarily sleep in, but but if that will help. And then obviously eat healthy and sort of avoid too much sugar in your diet. More healthy.
If anything, COVID-19 is teaching us how to really take care of our body in a very holistic way, you know. Yeah. Michelle, what do you think is the psychological effect that COVID, I don't always want to say COVID-19, but it is true. We are so much more aware of our mental stability right now. What do you think is the psychological effect that it has had on the Namibian nation for now?
And what you're saying about being aware of now our mental stability, I think a lot of people are also afraid because they're starting to realize, but I'm more anxious now. I have these depressive symptoms, and it's things that people never expected they would experience. So I think a lot of people are also still in denial about their mental health, and they're just so focused on, I don't want to get COVID, I don't want to get COVID. And then when someone does get COVID or they lose someone to COVID, it's almost like they're still in that denial phase. They don't really want to believe it's happening. So when you look at the psychological implications, I think we haven't even seen the drastic effect of the psychological implications yet. I think if we look at from the first to the second wave, there was a lot of increase in anxiety, fear was there, uncertainty. Now with the third wave, we're seeing a lot of depression, a lot of suicide ideation, a lot of helplessness, hopelessness, a lot of substance abuse as well, because like I said, people aren't coping. So they're trying to use other ways to avoid having to deal with what's actually happening. So yeah, psychologically, I think people are still going to experience the effects. I think if you also look at grief, people don't even have time to grieve because they lose one person and then the next day they hear of another person. So it's, I think the psychological impacts we're still gonna see a lot more.
Michelle, you did say that we have not even seen half of the psychological effects that this virus has or is going to still show us. But currently, right now, with everything that's going on, you know, we're just overwhelmed and we're receiving information left, right, and center. How does one really just step back and try and filter and say, you know what, this is for me, this I shouldn't do? Because, you know, you want to be on social media. You cannot be on social media and stuff like that, Yeah,
I think with being overwhelmed, you also, again, need to look at what are you feeding your brain with on social media? Are you feeding it with conspiracy theories? Are you feeding it with, what are your sources, basically, that you're looking at? And also with being overwhelmed, there's also a fine line between being overwhelmed and also almost becoming obsessed. You know, I've heard of some of my patients who wake up, put on the TV, constantly watching the news. And I'm not saying watching the news is a bad thing, But you're feeding your brain, and your brain is becoming overwhelmed, and then your emotions are becoming overwhelmed because all you're instilling is fear and sadness with what's going on in the world. So yes, like you say, you can't cut off from social media, but maybe limiting the amount of time you're on social media and looking at the resources. Educate yourself, yes, but don't go and watch all these videos on different types of things. That's going to be overwhelming. So again, same thing I said earlier, ask the right questions, but also to the right people.
Dr. Bruwer, Michelle mentioned all these conspiracy theories, and when they rolled out or introduced the vaccine, and currently right now, the vaccine still has a very negative connotation towards it. We are afraid of it. That is the reality. I would have thought that by introducing this vaccine, we would have been overwhelmed and overflooded. Like we should all have been vaccinated right now. But because of the conspiracy theories right now, as a doctor, how do you cope around I'm sure you find patients coming in and telling you 10,000 stories as to why they cannot take this vaccine. I don't even know how to ask this question. Yeah. Do you think that the way that it was introduced has affected the way how we receive it? Could it have been done better or differently? And now that we are going through this pandemic, we are literally paying the price of just trying to tell people that this vaccine is good for you.
I think the important thing to understand is we've had vaccines for hundreds of years, and we've had the anti-vaxxers for almost the same period of time. The difference now is with the advent of social media and the availability of the internet and data sharing, the anti-vaxxers have got unfortunately a very big platform to spread misinformation, and that put us on the back foot a bit, caught us almost off guard, and unfortunately there's a lot of misinformation. I've heard the most horrendous stories, and one must always try and, if you get confronted with this, try and see where does this come from, and then try and see, okay, how do you answer that? I mean, there's many questions about. There was a story about people dying after a year, and then they changed it off, dying after 2 years getting the vaccine, and now I heard that they pushed it out to 5 years, and it's all based on unfortunately misinformation that gets distributed widely through the internet. And where I think why they got a lot of traction was because this is a worldwide pandemic. So people will say, but normally medication or vaccines gets researched over many, many, many years. And because of the shortened time span, a lot of this stories, if you want to call it, got traction. One must understand with this vaccine development has been ongoing. We had SARS-1 in 2003, if I remember correctly, and MERS in 2008, and vaccines, these companies were already starting back then to develop vaccines against coronavirus, and the know-how is there. And what happened was, in the last 18 months, there's been a massive international collaboration with information sharing and helping the development of these vaccines to speeden up the thing. But vaccine development went through all the necessary steps, all the research that was done into it. There's so much scrutiny on vaccines that as a healthcare professional, seeing firsthand, having to manage these patients, seeing the extreme devastation that this disease is causing us, and having a medication available that we know can protect us, and lessen the impact on the healthcare system. It's really frustrating to have to sit with all these misinformation and sort of trying the whole time to almost convince people stand on the mountains and shout just to get the information out. Because I think the reality for us is, we saw what happened now during the third wave, and I'm sort of scared what might happen in the future if we don't get our population vaccinated. And unfortunately, there's a lot of people that's speaking against vaccines, which we should really try and get the right information out.
Yeah. I'm also one of those people, I guess, that also needs to really read up on the vaccine and really just understand it completely. You know, we take something, we get vaccinated, and then it ends there because you just want to save your life. But I think you need to understand the bigger picture behind it, so that when you have a conversation with the next person, you are able to tell the person, you know, you are increasing your chances of just survival. Because if anything, the vaccine does not mean you cannot get COVID-19. It just reduces your chances of getting it severely, correct? Your symptoms.
Yeah, I mean, it does reduce the chance of getting sick. I mentioned right at the beginning of the talk, I mean, even, let's call it 75, 80% reduction in the risk of getting the disease. So it does reduce the risk. But even if you have got the vaccine, you can still get it. Yeah. The chances are just that you will not get it as severe as you would have. And ultimately that's what one has to have, or what one wants, because that keeps you out of the hospital, that keeps you out of the ICU, and that keeps you alive. So that's what the main sort of information is. And I think if one has to go and look at how vaccines work, I mean, there's many vaccines available. You can educate yourself quite well with proper information from reputable sources. WHO explains it very well in a sort of easy manner to understand. You don't have to be a medical professional to understand how the vaccine works, what happens once the vaccine gets injected to your body, how does it prepare your body to react to the coronavirus, and why it should not have long-term effects, why vaccines work exactly. And so these things are available. The important thing is just go to the reputable sources. Don't go to the WhatsApp video or the YouTube video of somebody that you don't know. You heard from somebody, this professor having so many publications, but you don't even just go and Google this person and see who is he or she, and is. So I think go to the reputable sources. These entities have guided us through many diseases for many years. It's not just with coronavirus. We know what they're saying is true, and we should really trust the science in this case.
Why is this disease so aggressive basically in adults? I see it a lot more in adults, and thank God for that, actually, you know. But our children right now, from what age can we get them vaccinated? And
okay, so in Namibia, the minimum age is still 18 years. There are some of the other vaccines that's been trialed. For instance, Pfizer vaccine in the US, they allow it from 12 years and above, and they're now looking at it from 2 years and above. So there's definitely research ongoing in younger age groups, and the reason is anybody can get it. It does not, I mean, we've seen babies get it, we see children get it. Fortunately, the younger population tend not to have as severe disease as the adults, probably to do with different immune responses. I mean, our immunity develops over time, and we do know with coronavirus, one of the main reasons that we get in certain patients get very sick respiratory disease, ARDS as one calls it, is actually the body's immune response overreacting towards the coronavirus. And so there might be differences, well, we know there are differences between how children's immunity works and how adult immunity works, and that will definitely play a role. But in saying that, it's still important to know that kids can still get it, and they can still spread it. So one has to still, even if you're a young adult or still a child, stick to the same rules to protect yourself.
Dr. Wanja, I'm just thinking, now that you're a COVID survivor, you definitely did take care of yourself before contracting the virus, and you had it, you've experienced it, it's over and done now. But has your perception changed towards it, and are you taking different precautions now, or are you now more paranoid and you don't even want to do anything when it comes to touching someone?
I was a bit paranoid, and I was not paranoid because of anything to do with touching or anything. I think I was more of, I was negative. I was like, I did everything and I still got it. what is it? What am I going to tell people now? I mean, I was telling them, don't do this, don't do this. What message am I going to get when I left hospital? But in about a few days, I told myself, no, I'm not going to go that way. I started looking back, and that's why I did that story I did about the caregivers at Lady Pohamba. And it's because I started looking back and saying, whatever it is you do, if you're going to get it, you'll get it. Just do your part. And I started looking at the caregivers. And I don't know if they remember the story, because I had this perspective. I didn't know, how do they take care of people with COVID? You know, like when you go to funerals, they have these, clothes that they wear, they're covered all over. So I kept thinking, I'd never really had that experience. So I thought it's the same thing when you go to hospital, like they come to you like that. Maybe they put the food somewhere there and you have to collect. You've read about such things. But now when I went to the hospital and I saw how they take care of you, they come to you, they're almost friends, really. They want to know. They want to know about you. They really care. So when I went back after about 2 days, I told myself, no, I'm not going that way. I'm going to come out with this positive mind. Then about this, there are people who, I can't touch this, I can't touch this. I told myself, no, I'm going to read about it, because now I know within about maybe 10 days, after 10 days, maybe there are things I can't really infect you, especially the coughing. I have to be careful. That is one of the things that have lingered. But now I know, I think I came out more positive. Yeah. Within a few days, I had convinced at least 5 people to get vaccinated. People I could not get, my colleagues, people I couldn't get to get vaccinated. Because I kept telling them, look here, my doctor said, if I was not vaccinated, chances of me getting out of that place alive were very, very low. So I came out with a different perspective. And then now, okay, there was also the fear of stigma, because actually last year I was doing a paper on stigma. And I came out with the fear, a bit of stigma. What will people do? And it affected my son at some point with, because I remember when the story came out and somebody who had said, had told me to send my son to go and pick a letter from him, called my son halfway through as he was going there. But luckily he had already gone and come back, and calls my son and says, oh, have you gotten to the office yet? He says, why? Because I'm thinking I want to keep my staff safe from the disease. And it's because I started thinking, does it have something to do with, because I told him, oh, look at this story. I had just sent it to him. Suddenly he calls my son and says, don't get there. Unfortunately, my son had already gone. I wrote to him. I didn't tell him much, but I wrote to him and I asked him, how many of your staff members are vaccinated? And he told me very few. I told him, my son is fully vaccinated. He actually is at a risk of getting it at your office than him infecting. Because I thought that's what. So the stigma, I thought about the stigma. I was a bit worried. But after some time, I said, forget it. I'm going to talk about it. If you want to stigmatize me, it's your problem. It is not my problem. I survived. I know why I survived, I think. Of course, I think it's still a miracle. The vaccination was very, very critical. And then after that, what you do once you're home, you get a lot of advice from people who've had it. But I also sieve. I sieve what I hear. Do this, do that, do that. I sieve. I decide what is it I'm going to do, what is it I cannot do, what is it I don't want to even hear about. And as I was saying earlier, it's very important that you decide, make a mental decision. My son and I had done that. We decided we are not going to listen to a lot of those theories. We are not going to watch. And I told him, let's decide, as I said, when the vaccination comes, let's get it. Let's forget about all these other theories. And I think that's the most important thing that happens. I am more positive. Those things of I can't touch this, I never had it last year. I never had it, and I'm not gonna go that way. I don't want to be a prisoner of this disease, of COVID. I'm going to do my part, but I refuse to be a prisoner of COVID. Yeah.
Exactly. I wanted to ask Dr. Mansfled something, but I quickly want to ask Michelle something. You mentioned a very important point, and we were actually having a discussion about it at work. Stigma. people don't even want to say that they have COVID. We are acting this thing as if it is, I don't know, you know, and we don't want to say that we have it. We only want to come and say maybe like, oh, I'm now a survivor. You get what I'm saying? And why is there, even people coming back to work, the receptant, us accepting them back and, you know, just working around them and stuff like that. There's so much stigma involved when it comes to COVID. What can we do? Employer groups, just people, because obviously you can't give the virus if you don't have the, spread the virus if you don't have it, but there is definitely stigma when it comes to COVID.
I think when you look at what is stigma and why do people stigmatize? People stigmatize when there's a deviation from the norm. So in terms of mental illness was always stigmatized. It was stigmatized because suddenly we were observing people that were deviating from the norm in that society. And that's exactly what COVID was. It was a new type of sickness. It was a new type of illness. And the underlying reason for stigma is you just simply don't understand it. And then you make your own assumptions and your own conclusions. How do we break down stigma? It's simple. Conversations of people who've experienced it. Educating yourself, talking to the right people. This is actually what happens. This is how it is contagious. So just looking at me, you're not going to get COVID. So I think with stigma and breaking it down, especially in the workplace, it's simply talking to those people and saying, you don't have to be afraid of me. I'm not in the contagious period anymore. Simple conversations, I think, is what's really going to send the message out there about COVID. Conversations with accurate information, factual information.
I hope this show provides that platform where we give simple conversations, you know. We might not ask all the questions right now, but we're definitely going to have more talks about this for sure.
I do just want to add on that when you're talking about stigma with COVID. Yeah. I think actually what we're seeing now is COVID itself is not so stigmatized anymore because it has almost become the norm. Every second person has now had COVID in Namibia with this third wave. I think what's highly stigmatized now is the vaccinations. And I think that's where we should also start having more conversations around vaccinations so we can break down that stigma and people can get vaccinated.
We finally come to the end of our lovely conversation, but before we end this show, I would just like Dr. Bruwer, would you have any final words, especially when it comes to the vaccination, and just each and everyone else? We're just going to say one last.
So thanks, Shah. Thank you for this initiative. I think it's a very good initiative. I think it's important to get the right information across. With regards to vaccines, I think one has to understand that the vaccines went through all the research, despite what social media is saying. They went through phase 1, phase 2, phase 3 trials. We've got real world experience with them. This has been used, vaccines around the world, and they're effective. They're effective in preventing disease, but more effective in preventing hospitalizations. And that's the one thing that we can do to take back control, get our lives back to normality, where we can go to sporting events and functions if we vaccinate. And we have to get that message across that we need the country to be vaccinated as soon as.
I think we shouldn't even get bored of having that conversation of just vaccination. I think there are more questions than the questions that we've just asked right now. You know, just people need to get information. Michelle?
I think my last words would just be that right now mentally we're all not okay. So let's be compassionate towards each other. Let's be kinder towards each other. And even though we do have to isolate a lot of the times, just know that you're not alone. A lot of people are struggling at the moment. So be compassionate, be kind, and speak up if you do need help.
Exactly. Dr. Mansfled?
Look, easiest way to say is look at the level of evidence. We passed the 3.5 billion doses of vaccine being given. In the countries where it is, like England, Holland, these countries are all opening up because they say they have vaccinated 2/3 of the country. We do see a climb in the numbers of positive cases, but the hospital admissions is not as high as expected. So the level of evidence is there. Take the vaccine. That is the easiest way to explain it.
Take the vaccine. Yeah. Dr. Wanja, any last words before we end the show?
Packaging the message for the youth in terms of the vaccination. Because what I found is most of the youth are very anti the vaccination. I don't know whether it's the way they're getting the message or they're just too lazy to go and line up for the vaccination. But I think we need to repackage the message, get them to their platform, get the message to their platforms. If we can find a platform where they can start asking those questions, where they're talking about, I can't get a child, I can't do this. Those kind of, we just repackage the message. Vaccination is the way out for everybody, but for the youth, we need to get them to where they are. Let's just see whether we can repackage, the medics can, and the media, start repackaging the message for the youth differently so that they can get to accept vaccination. Yeah.
Exactly. Before we end the show, I definitely know that the main message right now is no longer about wearing your mask and social distancing. I think that message has been received. Right now, we need to start getting back to normalizing our lifestyles, and that will start definitely with getting the vaccination and just changing our perception, changing the narrative, the negative narrative when it comes to the vaccine. Dr. Mansfled, this is literally the last question and then we end it off. Can you please just tell everyone out there, if they've already had the COVID virus and they would like to go out and get vaccinated, what is the waiting period for them to just get that jab and get vaccinated?
Me?
Oh, sorry. Did I say that?
Mansfled, yeah. So okay, yeah. No, so it's basically 4 weeks after you had COVID, you can get vaccinated. We know that natural immunity at least most likely gives you immunity for about 3 months. Probably about 8 months still, but we don't, not necessarily with everybody. And then after 8 months, natural immunity starts to wane off. There is a thing called immune memory that we can't test at this stage, which might confer long-term immunity, but we don't know. But in the long and the short is, if you had COVID, we still want you to vaccinate. Probably within the first 3 months to get your full vaccination, and it's safe to go vaccinate after 4 weeks.
Awesome. So after 4 weeks, you can definitely get vaccinated. And while we are all fighting this pandemic, please preserve and protect your mental state. Your mental clarity is so important. And let's protect each other out there. And like Michelle said, let's try to show more compassion, be more kind to each other. And from me and NMC, we'd like to say thank you so much for joining us on our first edition of On the Couch with NMC, where we have candid conversations, real conversations about lifestyle issues and social issues that are affecting us. See you soon.